All right, we should be
All
good.
right. Okay. Thanks, Brett. All right. Well, welcome everyone. Happy or good afternoon, and thanks for taking time to hop on this update call with us. Might be a little smaller group today as we. This is kind of an interesting, shorter work week. So we'll go ahead and start with review of the numbers and the data. So I'll turn it over to Jordan Paul, our epidemiologist, and have her share that information with you.
All right, thanks, Kevin. So from last Friday at 3 p.m. until yesterday at 3 p.m., we had 468 new cases. Our total number of jurisdiction-wide cases as of yesterday was 5,734. This is a 21% increase in cases overall over the past week. Over that same time period, cases have been identified from school exposures, household and other non-household family exposures, care facility workers and residents, healthcare workers. There was a case who was tested pre-surgically, those who were in attendance of social gatherings and religious services, people who recently traveled, community contacts, and other worksite exposures. Cases by county as of yesterday are Crawford with 272, Kalkaska 282, Lake 175, Manistee 314, Mason 494, Mecosta 1045, and Ferris State University reporting 470 cases, Misaki 232, Newaygo 1377, Oceana 1047, Wexford 496. In the past week, there were 15 deaths and 265 people recovered. I did want to mention a couple things about our dashboard, which is on our website. If you want more information for confirmed cases, probable cases, or deaths for a particular county, you can click on that county in the totals column on the first page of the dashboard, and the age and gender columns will automatically update to show you only what's for that county. Additionally, Munson Manistee has began taking COVID-19 patients within the past week, so that hospital has been added to page 4 of our dashboard. That's all I have.
Okay, thanks, Jordan. Any questions for Jordan on any of the data? Okay. All right. Well, if you do, don't hesitate to reach out. Again, as you can see, cases continue to increase, as do deaths associated with this. So we are trying to stay on top of that. Some other stuff that's going on. We do continue to work with setting up flu clinics, and we do have some drive-through flu clinics that we're getting set up in our counties. So I'll give you some dates and locations, and then we can send out. We believe we have a flyer on this also, so we can send this out to everybody too. But in Cadillac, we are going to have a clinic on December 1st. It will be from 5 to 8 p.m. This will be at the Cherry Grove Fire Department. On December 4th, we'll have a clinic also in Cadillac. That's going to be from 9 a.m. to 3 p.m. and that's going to be at the Herring Township Fire Department. On November 24th, which is today, from 12 to 6 p.m., there is a clinic in Grayling at the Grayling Fire Department. On December 9th, from 5 to 8 p.m., we're going to have a clinic in Mesick at the Mesick Bus Garage. And then in Manistee on December 1st from 9 a.m. to 3 p.m., there will be a flu clinic at the Manistee Road Commission. So these are some drive-through flu clinic opportunities that people have. We may be setting a few more of these up, but for right now, these are the ones that we do have up. And like I said, we'll get we can get a flyer, excuse me, we can get a flyer out to everyone on this. You may have seen that we did put out, a health advisory yesterday. The health advisory, again, just references the increase in cases that we are seeing, encouraging people to make sure that they're following what's in the new emergency or epidemic order that MDHHS has put out there. Advised people against travel if at all possible, and then provided a list of recommendations if they are going to engage in gatherings, then looking at doing some of these. This advisory replaces a previous advisory that we have had in effect for a while. And so this one will remain in effect until it is listed. We also did put out a public statement indicating that the health department is no longer going to publish potential exposure sites in the community. And I mean, as an agency, we have been very strict and careful related to the exposure sites that we have put out in the media. We have done a pretty good job of being able to identify from positive cases we get all of the potential contacts that these individuals may come in contact with, so that we haven't necessarily had to put out as many public exposure sites. The problem now, though, is because of the volume of cases that we are seeing, we can't keep up with it, and so it really becomes more of a manpower issue. That we have everybody focused working on case investigation, contact tracing, that we can't continue to kind of investigate these low risk type of exposures. And honestly, with the level and degree of community spread that we have going on, everyone should expect that the risk is going to increase anytime you leave your home. That the risk is going to increase for potentially coming in contact with the COVID-19 virus. And so individuals need to make sure that they're taking personal responsibility for protection, making sure that they are, wearing their masks, following proper hygiene, maintaining social distancing, and avoiding large gatherings and groups. Again, those tend to be where we see the biggest increase in cases that we have. So those are two other things that we have that we've just released. We do continue to deal with enforcement issues in some entities throughout the jurisdiction that are operating in defiance of the emergency or epidemic order. And so we will continue to work to address those as best we can. There is a process in place where, in collaboration with MSP, we can have a report issued and then send up through a chain or a process that MDHHS has created that would allow for fines and citations to be issued by the state health department. And so we will be utilizing that. I mean, as a health department, we do not have the authority to issue fines or citations. And so this allows us that, and we don't have to work through our local prosecutors. And so that's another issue that's out there. We also are continuing to meet and plan for what is going to happen with COVID vaccination. More and more information is becoming available. The thinking is that we know that the vaccine manufacturers have applied for emergency utilization of their vaccine. I believe Pfizer has, and I think Moderna is if they haven't already, they will be shortly here. And so anticipating that is going to be granted in early December, which is not that far away, and then beginning to receive vaccine after that. The prioritization groups, I do not believe, have yet been finalized. There is some draft groupings out there. Originally, it was going to be 1A and 1B. Now it appears it's going to be 1A, 1B, and 1C, maybe the groups. And so still some discussion about who's going to be included in with those. It does appear as though essential workers would be included in the 1B group. High-risk adults would be in the 1C group, and then other healthcare workers would be in that 1A group. But I'm sure there will be more to come on that as more information becomes available on that. So right now, working with our healthcare partners to assure that they have a plan in place to immunize or vaccinate all of their staff, and then internally kind of the same process that we are going through. The last thing to kind of share here again, and I shared this last week, but you know, the continued strain that we're seeing on our healthcare, on the healthcare system, almost across the board, our healthcare systems or local hospitals are operating above, at, or just slightly below capacity. And for those that may not be at capacity, while they may have beds, they don't have staff to cover those beds. And so as quickly as they're discharging a individual, that bed is filling back up with a new positive individual. And so really needing to encourage everyone to follow the guidance that's out there so that we're not taxing an already taxed healthcare system. So those are some of the pieces that I wanted to share with you today. And other than that, Brett, I don't know if there's anything you want to share.
I guess the only thing is, I don't recall when you were mentioning flu clinics, if you mentioned our testing site in Ludington, Sunday, December 6th from 10 to 3. We're going to do
I missed that.
Testing.
Thank you. Mason County has requested a pop-up community COVID testing site. And so we have worked with the company the state has contracted with called Hanu. And we will be setting up a testing site on, as Brett said, Sunday, December 6th. The times, Brett?
10 to 3.
10 to 3. This will be at the Department of Public Works building. It'll be a drive-through site. And then we also will be offering flu immunizations there as part of that. So if individuals are interested in that, they can take advantage of that. If there are other communities out there that would be interested in looking at or exploring doing a community testing site, you know, go ahead and reach out to me, and we will see what we can do to potentially get something set up. No guarantees, but we will see what we can do. There is a new company that we learned about last Friday on a call. It's called Vault. This company is also does testing. They utilize a saliva test method as opposed to the nasopharyngeal, where you have that probe stuck up your nose. This one would be, you would spit into a tube, and then a sample of that would be taken. Accuracy is good for this test. So that's another option that's out there. This company, Vault, as I said, predominantly will work in the Upper Peninsula and in the northern lower part of Michigan, which would encompass all 10 of our counties if we want to move forward with them. And the benefit of going with Vault is they pretty much run the entire show. It requires very little staffing pieces on our part, unless we wanted to look at incorporating in a flu clinic or some other type of clinic along with that. So when we met with them on Friday, the state was still negotiating a contract with them. But if that contract gets finalized, that would give us another option for testing if there is interest in the communities to have that testing done. So something to kind of keep you know, in the back of your mind. If this is something that you think would be a benefit in your community, let us know, and we can begin to kind of explore that. You know, we would need to probably look at this as more of a drive-through type of a testing option. Although if we have a large indoor type of facility where we can spread people out, then that would work as an option also for the saliva testing going through Vault. So other than that, I think that's what I have. Are there questions in the chat, Brett? I'm not
Yep, we have
technically
one.
to that.
So it says, there's been a lot of conversation in our school district regarding the fact that we are still in phase 4, even though the literature and guidance from this summer, when we had to formulate our return to learn plans, would have us in a much more restrictive phase with the current numbers. Are we not following that guidance plan rubric anymore?
Yes and no. And part of that is, the positive is that rubric that was created was not created as part of the executive order. So when the executive order or the process used to put in place the executive orders was ruled unconstitutional, thus suspending them, it didn't require that rubric also have to disappear. The problem is and we've had some internal conversation on this, is that individuals are looking or want to have kind of a black and white answer. If it's this, then this is the response, and that's not always possible in looking at this. So in addition to what's in that rubric, there's also some other factors that we have to take into consideration. And so looking at, where may, so if we are seeing an increase in cases, where exactly may those cases be coming from? Are they associated with maybe an outbreak at a certain facility, or is it something that's across the entire, that's across the entire community, where we're seeing a lot of community spread? The other thing with regards to schools, and I know I've had a number of calls and questions from the elementary schools, especially since they have remained in person, and why that is, and their concerns. We really have not necessarily been seeing a huge number of cases in the elementary schools, and those cases that we're seeing are not necessarily school associated cases. And what I mean by that is the cases are coming from outside in the community and then into the school. We're not necessarily seeing that Johnny, a lot of cases where, Johnny is infected in school and his infection results in Sally or Jenny becoming infected. That's what we're not necessarily seeing a whole lot of that. And so, yes, while, yes, we do have, unfortunately, there may not be a lot of cases, but you are still seeing a large number of contacts, unfortunately, associated with these school cases. I think, both Dr. Morris and myself are still, comfortable sticking to the recommendation that we have made, that, if at all possible, we want to keep the elementary schools going as long as we can. I don't know if that answers that question or not, but that was kind of a rambling around answer to it.
Okay, that was the only question in the chat box. So how about people who are only on the phone? Would you like to unmute and ask a question?
Hi guys, Jason Torrey from Manistee here. 2 questions. One, the potential testing, if we want to try to do it, is that like we did early on, or is that a different type of testing?
It would, if we go with the Hanu company, it would be somewhat similar. I would think, in terms of, it still would be the nasal pharyngeal testing. It would be kind of a drive-through type testing. I think, and Brett, correct me if I'm wrong, probably the biggest change would be a lot of the registration and all that is done up front, working with this particular company.
Correct.
So in some respects, it may move a little bit quicker. I don't know, Brett, is that fair, or?
Yeah, that's a yes and no too, because yes, they use at least with Hanu, they use a QR code so that people can pre-register, and then they can also do it in line before they get up. So there's no paperwork that's used. So that's a good benefit. What will make the difference though is how many staff they bring in and how many cars they can do at a given time. Because, for example, if they only have 2 staff, it would take a lot longer than if you had 10 staff. So that's really going to be the issue.
And do you know, are they, whoever's in charge, are they going to do any of the antibody testing, or is that just for see if you currently have it?
No, I believe this is just all PCR testing.
Correct.
Okay. And then the other question I had, on the EM webinar this morning, they were talking about who was, you know, like you were saying, the stages of people that are going to get the first vaccine. Is there some process? I mean, because some people are going to get sick just building up the antibodies and stuff to it, like a flu shot is what they described. I mean, if everybody in our agency, let's say, took it and even half of them get sick, we're really in trouble. Is there any process for how that's going to be taken care of?
I guess I'm not. Maybe I didn't understand your question, Jace. Do you mind sharing it again?
So it was, yeah, no, not a problem. So it was brought up how, you know, like when people get flu shots, some people think the shot made them sick, but they get the symptoms and get sick while they're building up, because they said it takes like 20 something days for your body to build up the immunities.
Mm-hmm.
So do you know, is it going to be stressed to do it in phases so you don't knock out a whole section of your agency or whatever all at once? Because I don't think anybody can afford to lose even a third of their agency.
I can probably answer that one, Kevin. So
go
Jason,
ahead.
the issue there is not with the shot itself. So you're correct that it generally takes about 2 weeks. So from the time you get your shot, there's a 10-day, 14-day period where if you did come in contact with the flu, you could get it even though you had the shot. So if I'm understanding your question correctly, it wouldn't really matter if we're phasing in the COVID vaccine, because it's not the vaccine that's causing them to get sick. I think it'd be the other way. It would be better to get everybody vaccinated day one, so that we only have a 2-week period for everybody to be at risk. And then the caveat there is, I haven't heard, maybe Kevin has, I haven't heard that 2-week period will be the same for COVID as with the flu. I haven't heard that.
Yeah, neither have I. And actually, I've got myself a note because I can check with Dr. Morris, our medical director, on that, and then kind of share that answer with the group.
Okay, yeah, if I recall correctly, it sounded like it was going to be about 20 days until they were saying. Or maybe that was in between doses. I can't recall.
Well, it will be, and that's actually a good point, because this will be a 2-shot series. And so depending upon the Pfizer or the Moderna vaccine, there is a difference. You know, I think one is 21 days, the other is 26 or 27 days between, you know, is that time frame between doses. So that may have been what it is, but I will check with Dr. Morris on that just to be sure. Okay.
Thank you. That's all I had.
Okay.
Hey, Brett.
Yes.
This is Lieutenant Thieker. Just some clarification on the last question. I think maybe what was being asked on the call this morning with EMs, DHHS was on and was indicating that just like with any other vaccination, there could be some symptoms. I hesitate to use that terminology, but you may not feel great that first day. You may have some sight redness, some inflammation, maybe some other things like that, where you're not feeling real well that first day. Not to get confused that that's a bad reaction. It's just your body that is creating that immunity or building that immunity up. I think that's what the question was. And then the 21 day was the indication between the 2 shots. So first day, and then you have to have 21 days before the second round.
Yep, and that makes sense, Orville. I guess my comment back would be, personally, I wouldn't try to do phases of vaccine based on, a day or two of someone not necessarily feeling perfect after the vaccination. That's just my take. And then before we got a couple questions in the chat. If y'all would confirm that you're on mute. I've noticed we can hear some typing and some whispering. So check your device for me. Okay, I think the next question was, what about the side effects of the vaccine being similar to the symptoms of COVID? Are people going to need to follow quarantine process during their symptom onset?
I will be honest, I have not heard much or seen much yet on the side effects or symptoms of with the vaccine. If the concern is that someone is displaying symptoms of COVID around the time they get the vaccine, I think it would be a question of what caused it, and was it the result of something else. I mean, the incubation, it can be up to 14 days that someone, after being exposed, can test positive for it. So to tie it back to the virus would be somewhat difficult to do. So I don't know, Orville, if that has been discussed on any of the calls.
No, the information, like you said, I don't know that that information has been released yet. I know it was Heidi, and I can't remember Heidi's last name, from DHHS, but she was the one that was discussing it this morning, and she was going to be forwarding out some additional information that may have some of the paperwork for both of the vaccines. And so that may have some of that information on it, but she did not indicate that there's been any side effects from the trials or anything like that.
Yeah, I think there's still a number of moving pieces around the vaccine. And as I said, originally it was going to be just 1A and 1B, and now they've added in a 1C group. So, I think as at the federal level, as they work this out and kind of complete what those groups are going to look like and who's going to be where, that we'll be finding out more about this and learning more about it so that we can share it with you then. Because I can tell you, I was on a call, we were on a state call Friday where they were talking about vaccine, and I was on another call just before I got on this one with a West Michigan group, and already there were differences in the messages that were being shared. So I think we kind of have to wait and see what the final product is going to be that's going to come out.
And Liz mentioned it was Heidi Lyons that was on the call that Orville was talking about. All right, next question says, I assume the community mental health staff are in line for 1B of the vaccine rollout.
And again, that I have not seen, who's where.
Okay, that was the last question in the chat box. So anybody else who's just on the phone that would like to unmute and ask a question.
Hey, Brett, this is Sheriff Falk, Manistee County.
Hi, go ahead.
Just wondering what the health department stance is on, in the past, if we've had an exposure, that employee has been off and gotten tested, the turnaround, it seems to be a problem, but is the health department still of that mindset to keep them off until that test come back negative or positive, or is the change to come back to work, if you have symptoms, then stay home until you get your test results? My question is, do they come back to work even if they don't have symptoms, if they've been exposed?
You want to take that, Kevin?
I can. Yep. I think the general guidance that we have provided to individuals is if you have been tested, obviously if you've been tested because you've had symptoms of COVID, you need to stay home until those results come back and we know what's going on. Even if your test comes back negative and you're still displaying those primary symptoms of COVID, our recommendation would still be to stay home for that 10 days. Now, if that person is asymptomatic and goes in and gets tested just because they want to get tested, I mean, in the perfect world or that, we'd like that person to stay home, but we also recognize that that's not always possible. And so, in some cases, whether it be a healthcare worker or whether it be EMS or first responders and law enforcement, those individuals, and this would be no different than if somebody were to be a close contact, they could come back provided they're wearing proper PPE. They're able to isolate and social, maintain social distance from others, and would be able to work as long as they are not displaying any symptoms. So I think in your case, if you've got somebody who's tested and they're asymptomatic and they're not having any symptoms, then I think they could come back and still work, just recognizing that, if that test comes back positive, now, you've got to do all the contact tracing and that goes along with that. And there may be some exposures there.
Thank you.
Mm-hmm.
Yeah, I got a follow up to that one. This is Jeff Donce, and it's probably been brought up before, but it would certainly be nice if we have the need to test any of our law enforcement and or first responders, that we could have a quick turnaround test, just because of the volume of people in that profession here is not high. We need to try to keep everybody available as possible. If they're not showing symptoms, then we can do that fast test turnaround.
Yeah, Jeff, we do have a supply, or we did receive a supply of the Abbott Bionox antigen testing cards that have a quick turnaround with them. We are going to have some staff that are going to be going through training on how to use those. That training is actually going to be Monday. And then, we'll be looking at moving those cards out into our communities, recognizing that the supply we have is a finite number. And so when they're gone, they're gone. And so, looking at our original thinking was we could use this in school situations where, we've got to do a quick turnaround to determine if a student is positive, possibly in a court type setting, where somebody, maybe a juror or suddenly develops symptoms. But I would think that they could also be used for EMS, law enforcement type personnel to work with that. There are some situations, though, depending upon, or I should say, there are some instances where, depending upon the situation around the positive person, that given the result that's going to come off of that card, we still may recommend a confirmation test through PCR, but that depends upon the situation. So we may have the ability to help with that, at least as long as the supply lasts for that population.
All right, got a couple more things in the chat box. So one is there was a link to an article related to effects of the vaccine. So for those that can see that, could click on that link. Then I think the next one was Spectrum Health is no longer testing asymptomatic persons, i.e. close contacts or exposures. This includes first responders, law enforcement personnel, and critical infrastructure workers. For those able to get tested, results are taking 7 days to get back. Are you aware of any other locations still offering asymptomatic testing?
I believe, and I don't know if Gwen is on from Northwest Michigan Health Services. They were testing asymptomatics, but I know that they had gone down to 1 or 2 days. Walgreens, I believe in Ludington and Cadillac, and there may be, I can't remember if there was another one that may be also doing testing, although you do need to have an appointment for it. There also are some what are called neighborhood testing sites, and I may have mentioned this before. These you need an appointment for, but there is no cost, and they will test asymptomatic individuals. In our area, the one that we have that's located within our jurisdiction is in Grayling. It's on the campus of Kirtland Community College, but they will test you there. There's another one in Muskegon on Sherman Boulevard at, I think it's Christ Temple Church. And then there is a new one that just opened up in the Grand area. And I don't have any other specific information on that, but those sites also would test asymptomatic individuals. So unfortunately, nothing real close, but.
Kevin, Gwen said Northwest Michigan Health Services in Shelby is still offering testing for asymptomatic patients. And Liz says Walgreens are still testing asymptomatic.
Okay, yep.
Okay, next question, I believe, was, would the rapid test be available for adult foster care homes in home testing?
They are. I believe there was an email that went out to some of those locations, at least the larger ones, that they could access those cards through the state to conduct that testing for. Some of the smaller homes may not have gotten that. If I can give you the contact information for the state, and you can see if they still have any left. Again, we may be able to share some of what we have, but the supply we've already been told that the supply that we have is probably all we're going to get of these, and so when they're gone, I'm not sure we're going to get any more. So, if that's why don't you email me if that's something that you're interested in, and I can check into that once we complete our training on Monday.
All right, that was the last one in the chat box. Anybody else on the phone have a question? All right, there's another comment in the chat, and it says, our Walgreens does not offer testing in Fremont.
Okay, yeah, I thought it was Ludington and Cadillac were the two locations that I had originally heard about. I wasn't sure if there were other Walgreens that had started to do that or not. So I will, I'll do some looking into that. I also, for next week's call, I can try to see if Dr. Morris would be available to be on the call, and maybe we can talk a little bit more about vaccine. If she's able to, so I can reach out to her and maybe see about doing that. As we get closer to it, I'm sure there'll be more questions that are going to have to, that people would like to have answered, and hopefully more information is going to be coming out regarding that. So I will try to do that for next week. But again, I'm not sure if her schedule will allow it or not.
That's all we have at this point, Kevin.
Okay. Anything from anyone else? All right. If not, then again, thank you guys for hopping on the call with us today. We'll do it again next Tuesday at 2 o'clock. Everybody's, stay safe. Have a happy Thanksgiving. Keep your groups or gatherings small, and we'll talk with you next week. Thanks, guys.